The government is promising that significant and sustained investment in the mental health sector starts with tomorrow's budget. In response to the mental health inquiry, the government today announced it would quickly set up an independent new commission and widen access to mental health services. But it's refusing to set a target for reducing suicide or to act on alcohol or personal use of controlled drugs, and gave no specific funding details. Our health correspondent Karen Brown reports.
A high-profile mental health and addiction inquiry led by Ron Patterson recommended major changes in mental health 6 months ago. Today, the Prime Minister announced at an event hosted by Newtown Union Health in Wellington that the government will accept or consider almost all of the inquiry's recommendations. But Jacinda Ardern drew the line at setting a target for reducing suicides, which reached 668 in the 2017-18 year.
There wasn't an evidence base that said if you have a suicide reduction target that it reduces the number of suicides. And at the same time, we were very wary of sending any message, particularly to bereaved families, that there was a tolerance for suicide in New Zealand. Every single life matters.
Ms Ardern also ruled out the stricter regulation of alcohol sought by the inquiry.
Those issues are conscience votes, and that was a long process that many parliamentarians have already gone through. What we have said is that, yes, there's work on advertising and so on, but actually when it comes to our response in this case, it is around the lack of availability around treatment services.
Replacing criminal sanctions for the possession of controlled drugs for personal use with fines or referrals was also rejected on the basis it's already been addressed by Parliament. That's disappointed the Drug Foundation Executive Director Ross Bell.
You can't extract some of the things and say, well, we're not going to do all of these things. So, yeah, we are disappointed the government hasn't come out and said, we've heard it from the Law Commission, we've heard it from this inquiry, we will reform our drug laws properly.
The Health Minister David Clark said work has already begun to set up a new mental health commission to oversee services and hold the government accountable.
We'll have an announcement tomorrow around funding, but now that we've accepted that in principle, we'll want to get on with it.
He added the changes will transform mental health and broaden access for those who need it.
And that doesn't matter as to what level of distress they have. The report itself points to the missing middle, those in New Zealand who haven't been able to access services readily. Of course, training workforces, training peer support workers will take time. So this transformation will take time, but we're determined to get on with it.
That's welcomed by Marion Blake, the Chief Executive of Platform, which provides services in the community. She says the wider scope means they'll be able to do far more in future.
It's an opportunity to use the whole of the community sector to actually look at issues around housing, employment, looking about trying to increase access to some services. So I just think it's a great opportunity to really begin to change the mental health system in New Zealand.
The figures backing up today's pledges will be revealed in the budget tomorrow. Mō te hotaka o te ahi, ko Karen Brown, tēnei.